One common cause of low back pain that doesn't go down your legs is arthritis in your low back. And these are called lumbar facet joints. You have 5 lumbar vertebrae, at least most people do. These are the ones that are below your rib cage. And these joints are involved when you twist or when you bend forward, they tend to open up, and when you straighten up, they tend to hurt. So it's very common for me to ask someone who has pets at home, which is worse, bending over to feed the dog or straightening up? Because most of the time they'll tell you that straightening up hurts more, because when they straighten up, they're pushing these joints together and compressing them. Another common finding for people with facet joint arthritis is if they roll over in bed at night. You would think that in bed with no load on your back it would be almost impossible to hurt, but actually when you roll over in bed you're twisting and it closes these joints on themselves, and so that tends to cause a twinge or pain in the middle of the night that will commonly wake people up. When we examine people for this, what we'll do is we'll have them arch their back, and when they arch their back, you can see the joints actually grind on themselves a little bit. And this is complicated by the fact that as we get older and we lose moisture in our discs, these discs get shorter, and so you lose your spacing on the joints as well. Another way that we test for this is under x-ray or just on the exam table, we can push on the spinous process here, and you can see it push into that joint there, and that actually causes discomfort. And if it's like the same pain they have at home, we know it's probably going to be coming from that. To diagnose this definitively, what we'll do is we'll put in, and you can see from the small marks in this model over the years where we've done this, when I point at it, we'll put in about 1/10 of a teaspoon of numbing medicine outside the joint, above and below it, because there's a nerve above and below it for each joint, and then we'll wait an hour and test them again to see if they feel like their pain has changed at all. Very commonly for people who do have facet joint arthritis, they'll have a lot less pain after an hour, and we'll send them out for the rest of the day to go do things that normally their back wouldn't like them to do. And if they have a great day, then we know that probably a large amount of their pain is coming from these joints. By using radiofrequency needles again to heat these joints, we can usually get about 8 to 12 months of relief. One of the few benefits of being older is if you're over the age of 70 or 80, we can sometimes see 1 to 2 years of relief. And during that time, again, we encourage physical therapy and exercise so that when they grow back, the pain doesn't return.